Philadelphia's Treatment, Not Trauma Coalition, Rally, and Press Conference. My name is T-Ba, and I'm the Executive Director with Freedom Alley. And we are here, gathered today in front of the Department of Behavioral Health and Intellectual Disability Services. That's a long name. It's a very long name. And as a parent that has to register autistic twins with this department, it's a very important name as well. We believe that when someone is having a mental health crisis, they should receive care, not cops. Services has the power to ensure that if someone calls 911 for a mental health emergency, a civilian mobile crisis team will arrive on the scene right away. We are here to demand that Commissioner Jill Bowen, let's say Jill Bowen, say it, Jill Bowen, ask the city to fully fund this effort and create a fully functional, comprehensive, non-police mental health response. So, who is we? We are the Philadelphia Treatment, Not Trauma Coalition. And we are social workers, therapists, nurses, academics, clinicians in behavioral health, policy advocates, mental health system, community organizers, service providers, concerned neighbors, and people impacted by the mental health system and over-policing. Now, this is serious. We came together after the murder of Walter Wallace, Jr. It was after the murder of Walter Wallace, Jr. by the Philadelphia police officers to ensure that what happened to him and his family never happens to another Philadelphian. Never. Yes, shame. Because we believe that mental health crisis response should be safe. It should be safe. It should be timely. It should be trauma-informed, and it should be clinician-led. Now, why is this issue important to me personally? Well, June the 5th, I have a young man and a young woman that will turn 21. Both are autistic. One, my son, a black man, is nonverbal, physically disabled with cerebral palsy. You can't tell him to freeze. You can't tell him to put his hands up. You can't tell him to stop. And if they should come in my house by accident, what do you think is going to happen? There will be another name next to Walter Wallace Jr. This right now, right here, is what we're talking about. Why treatment, not trauma, is so vital to so many of us. So I want to hear you chant with me that we want care, not cops. Treatment, not trauma. 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 Today, you'll hear from other treatment, not trauma members about why this issue is so important. But first, let's welcome our council members who have been our allies, fighting for us and our demanded services since the beginning. That would be Council Member Kendra Brooks, Council Member Helen Gym, and Council Member Gautier. All right, Kendra, you're first, Councilwoman. See. Good morning, everybody. Good afternoon. Can you hear me? Yes. All right, thank you, guys. So my name is Councilmember Kendra Brooks, and I joined this fight because, where I live in Nicetown, a community that's highly policed, it's a lot of gun violence, but it's also a lot of trauma. And we realized that in my neighborhood, there's a police officer on every other block when you come to my house. What I realized is that when something happens in my community, all all the things that we request and ask for don't happen. We have to continue to fight for the things that we want. When I think about my children, my daughters, I have 4 daughters who have buried more friends in their lifetime than I have. It's sad. And the trauma overlaps into our community. We have a community that does not trust. We don't know who to trust. We don't trust the cops. We're learning how to trust our community members. It's the trauma that continues to grow and cause harm in our community. So this request for treatment, not trauma, is based on the fact that we need more. Not more cops, we need more support. We need more services. We need more investment in schools. We need more investment in parks and recreation center. We need more investment in out-of-school time programs. We need more investments into social work and programs in communities to help young people overcome.
What we need to do is stop bullshitting.
So what we need to do is start reimagining what public safety is and what community safety is, and start to work on it for ourselves. And part of it is demanding and requesting and rallying that mental health crisis teams are a necessity. When we think about the trauma that we went through over these last couple of years, and the trauma that our community is still going through, it's going to take a while for us to overcome this. And the only way we can do it by sound investment in people. In people. We need those social workers in every community. We need those mobile therapists in every community. When a crisis happens on our block, you want to pick up the phone and know that someone's coming to your door for support. Not to re-traumatize you, not for harassment, just for support. So I stand here with this Treatment Not Trauma Coalition demanding with you, alongside, we need funding. Our budget season is coming, and we need to fund the things that the people are asking for. And what we want to fund is treatment, not trauma. And we need it immediately. Thank you. Councilwoman Brooks, thank you. Thank you. Now we'd love to hear from Councilwoman Helen Gym.
Thank you, everybody. So to everybody who's out here today, to the Treatment Not Trauma Coalition, to Amistad Law Project, to the social workers, to our behavioral health specialists, you are the backbone of this city. As integral and important to the health and prosperity of Philadelphia as any of these buildings in the skyline or on any of the businesses that are advertising on these horrible neon signs surrounding us. I want this city to know that its prosperity and its future is rooted in the love, care, dignity, and treatment that emanates from the people in this coalition, and that's who we're standing with today. So a year ago, the Treatment Not Trauma Coalition came together in a moral call to demand that we invest in the health and well-being of our residents, of our citizens, and of our young people. Piloting the very first call for a mobile health crisis unit was a great victory for this coalition. But we are here 1 year later to say we got more work to do and not enough has been done. And so I want you to know that on City Council, we will continue to work with you to demand that the Department of Behavioral Health, that the City of Philadelphia, the Police Department, and everybody here prioritizes these mobile crisis units, their expansion, and most importantly, the professional training that goes along with people who understand how to respond, not by escalating, but by bringing together a sense of humanity to inhumane situations. The hardest calls that my colleagues and I get come from parents and family members in distress. Parents and family members who feel like they're losing hold of their children, who've lost a young person or a loved one in their household who has wandered off. Somebody who has been struggling with addiction, and others who are struggling with other forms of health-related needs. More than anything else, what we hear the families and the loved ones for whom they have a home and a family and people who will love and continue to care for them. That's what this effort is all about. That's why we're going to continue to stand with you and demand, as my colleague said, in the name of Walter Wallace, in the name of every single individual and family member who deserves to have their loved ones come home to them, that this fight is one of the most important we will see in our budget session, and the one where we're going to have to see a lot of unity. So stay strong, stay engaged, and let's get active. Thank you.
Always fire. Helen Gym, always on fire. So, next, without further ado, Councilwoman Jamie Gautier. Good afternoon, everybody. I want to start off by thanking the Treatment Not Trauma Coalition for gathering us all here today, for their constant efforts to raise awareness around this very important issue, and for all of their work to center the mental health and well-being as well as the physical safety of every Philadelphian. Last year, the City of Philadelphia allocated millions of dollars of new funding to expand mobile crisis units here in Philadelphia that are dispatched by 911 in response to mental health emergencies. This action came after passionate protest and activism in the wake of Walter Wallace Jr. shooting by police in my district. During these protests, Philadelphians made their voices heard loudly and clearly. They said, we don't want a law enforcement officer to be the one and only response when someone's having a mental health crisis. They said an armed response should not be the first response. And they said sending cops to a mental health emergency has the possibility of escalation, of arrest and incarceration, and even of injury and death, as we saw in the tragic case of Walter Wallace Jr. We're in a situation here in our city where people are afraid to call 911 when their loved ones are in crisis because they don't want to put their loved ones' well-being at harm. A system where, you call for help and you receive violence and trauma, that's called a broken system. When someone is having a mental health emergency, we need to respond with culturally competent crisis responders who are well-versed in how to compassionately and effectively respond to these kinds of situations, to de-escalate rather than harm and punish people. Mobile crisis units provide exactly this type of intervention and are trained to handle these situations, prioritizing the safety of both the person in crisis and their surrounding community. But back to the issue of the funding. The step we took last year was a great first step, but it is not enough and it doesn't meet the needs of Philadelphia's need for expanded mental health services and intervention. We have to do more, right? Yes. And it's not even just about the funding, it's also about the deployment. Here we are a year after the allocation of that funding and our mobile crisis units are at a standstill. We have 4 mobile crisis teams to serve the entire city of Philadelphia. 4! There are 1.6 million people in this city. It should go without saying that that's not enough and that's not sustainable, right? So we have to get serious about this. And so that's why this budget season, I'm joining with my colleagues, council members Gym and Brooks, to call for additional funding to expand mobile crisis units. We don't ever want to see another Walter Wallace Jr. in this city again. Never again. And so this is the step that we need to take to prevent what happened to Walter Wallace Jr. as well as to countless black men and women that died at the hands of police when they needed help. Thank you so much. Councilwoman Kendra Brooks. I want to thank Councilwoman Helen Gym and Councilwoman Jamie Gautier. Thank you so much. Because guess what? Guess what? We are not alone. We're not alone. Let me tell you who's with us. Tower, Live Free, Lutheran Settlement House, Viet Lee, Anchor, also known as ACRE, Juntos, White Anti-Racist Social Work Action Group, WARSWAG, Marijuana Justice Virginia, one of my favorites, Abolitionist Law Center, Black and Latinx Community Control of Health, Act Up, Philadelphia Reentry Think Tank, Black Lives Matter, Philly. Why not prosper? Physicians for Social Responsibility, Pennsylvania, up against the Law Legal Collective. But I also want to thank our Snacktime Philly, our band, and of course, Parents Smith. Now listen, I got a treat for you. I want to introduce Treatment Not Trauma. It's the Coalition's co-founder and a licensed clinical social worker, Nomi Twitch.
Can y'all hear me okay? All right. Good afternoon, everybody. As a social worker, a mother, and a community member, I know that each and every Philadelphian deserves a compassionate and supportive response if they experience a mental health emergency. When Walter Wallace Jr. was tragically murdered at the hands of police just a few miles from where we stand today, our city again witnessed the dire consequences of having police serve as the de facto first responders for people experiencing mental health crises here in Philly. If you are having a fire in your house and you call 911, you will be sent a fire truck and a team who specializes in putting out fires. If you call 911 in a medical emergency, you will be sent an ambulance and a team of medical professionals. But if you call 911 during a mental health emergency, you currently still get police at your door. As a clinician, I know from experience that what is needed most in a moment of mental health crisis is to establish trust and safety and to de-escalate the situation. What this looks like depends on the person and their individual needs. Some people might need space. Some people might need to feel closely connected. Social workers are trained to be attuned to those needs and to understand the situation, to create a safe environment and to help the person de-escalate. Police presence is in and of itself an escalation. When someone arrives armed with a weapon and in a uniform that is associated with punishment and control, it does not communicate to the person in crisis that they are safe or that their well-being is being prioritized. It communicates that they are in trouble. And for many of the Black and brown people with whom I work, I know that it communicates that they may be in danger as well, either of bodily harm or of incarceration. What is needed in that moment is care, not coercion. Non-police crisis response programs are having great success all over this country. There's Parachute NYC in New York, Mental Health First in Sacramento, Cahoots in Eugene, Street Crisis Response in San Francisco, PAD 311 in Atlanta, STAR in Denver, Crisis Call Diversion in Houston, 911 Crisis Response in Phoenix, Macro in Oakland. The list goes on and on. There's
to better outcomes for the individuals who they serve, but also that they are extremely cost effective for the cities that house them. They prevent unnecessary hospitalizations as well as unnecessary incarceration, and they help people to move safely through a terrible crisis moment and into whatever is next for them. Fully implementing a program like this here in Philly is common sense.
Common sense!
Here in Philadelphia, as you've been hearing, our program has already been launched. Now, all it needs is commitment and investment from the leadership of this city. Every Philadelphian has the right to compassionate, safe, and timely crisis care. And whether or not this is available to you just cannot depend on whether you happen to know a certain 10-digit phone number, or whether you get lucky and one of Philadelphia's pilot teams happens to be available when you call. Let me repeat, the fact that Philadelphia has begun to expand the mobile crisis program does not mean that it is accessible to Philadelphians at this time. DBHIDS needs to expand this program to be fully operational and consistently dispatched via 911. So we, all of us, all of you, we are here today to urge Dr. Bowen to take the first step. Ask the mayor to fully fund the mobile crisis program. And Dr. Bowen, when you do that, we, all of us, will fight alongside you until we make it happen. Because we know that the lives of Philadelphians and the soul of this city is at stake in this fight.
We just heard from the coalition co-founder and a licensed clinical social worker, Nomi Toit. And next, from the 188, we've got State Rep Krajewski.
Good afternoon, everyone. I am State Representative Rick Krajewski of the 188th District in the Pennsylvania House. I am here in solidarity with the Treatment Not Trauma campaign. Our council members leading the charge here in Philadelphia. All of you leaders and organizers and advocates fighting to make sure that our folks having mental health crises are getting the treatment and compassion they deserve, right? And for me, I'm thinking in remembrance of Walter Wallace and all of the other Black and brown Philadelphians who deserve care, not police violence. I'm thinking about Christian Hall and all the other Pennsylvanians, right, who deserve care and compassion, not police violence. And we can't talk about this issue if we also can't address the racialization around mental health crises, right? When Black and brown people have mental health episodes, we're considered irrational, unstable, violent, right? Whereas with white people, it's just a moment, it's an episode, right? But for us, we're immediately dehumanized and brutalized, and that is in the heart of policing in this city and in this state, right? It seems like with this epidemic, with these crises that we're dealing with in our communities, police are now being told to be guidance counselors, rec center leaders, right? Enforcing violence in all of our communities, and it's unacceptable, right? It's unacceptable. We cannot have another life taken because we're not fully funding our mental health resources while our police budgets get bigger and bigger, right? Am I right? And so I'm here in solidarity to demand that the mayor and all of our city actors fully fund our mobile mental health crises, right? So that we have 24/7 access so the people have the treatment and care that they deserve. But I'm also here as someone who's in the state house and really saying that we also have to hold the institution of policing accountable in this state, right? We have to completely change the way we think about community safety, the way we think about responses to conflicts, and really saying what are our priorities as a city and as a Commonwealth. Are we going to invest in healthy schools? Are we going to invest in good jobs? Are we going to invest in our parks, our rec centers, and our green spaces Are we going to invest in a system that is clearly not only not working, but is enforcing and causing violence every single day, right? And everyone here is very clear about what future we deserve. So that's why I'm here with you, fighting to make sure that our city becomes the kind of city that we deserve, the kind of city that treats people with care and compassion, not trauma, and also giving you my commitment that I'm going to bring that fight to Harrisburg as well. So thank you.
Thank you, our very own Krajewski, State Rep 188. Now listen, cops can't heal. Cops can't heal. Cops can't heal. So when I say money for what, you say not police. Money for what?
Not police.
Money for what?
Not police.
Money for what?
Not police.
Money for what?
Not police.
Money for what?
Not police.
I can't hear you. Money for what?
Not police.
That's right, not police. Now next up, we're going to hear a powerful story from a very brave individual and former Philadelphia gallery owner, Liz B. Fisher. Her story will be read by our very own Annette Day, a treatment not trauma member and president of Pennsylvania Society for Clinical Social Work. Come on up here, Annette Day. Thank you.
Hey, thanks for coming out. Can y'all hear me good? All right. So again, my name is Annette, and before I read Liz's story, I wanted to say I am, again, a social worker, I'm a therapist, and I am a mother. Many of us have stories that resonate and are similar to Liz's story here. So we wanted y'all to get a personal take and hear a story about what happens in this city all the time. This is Liz's story. Imagine you have a spouse with mental health challenges. Perhaps they were always quirky, and now you find they seem tuned into their own private radio station. You start to worry. And because denial is frequently present with mental illness, they do not think they need help. They think they're in some glorious elevated state, and you're just reigning in their parade. Call doctors. They say they cannot do anything, and that the patient must seek treatment on their own. You try to convince your spouse to call a doctor. They promise to call. The call is never made. Every day when you come home, you don't know what you will find. Now, imagine that now your spouse has thrown out their wedding ring and has given more money to charity than you can afford. Still, you cannot force them to get help. Their parents are concerned. So are their siblings. They offer to help. You research how to have an intervention. Where in-laws come to help and the results are disastrous. Instead of getting help, your spouse gets arrested. This happened to Liz's family on Friday, May 5th, 2017. Husband asked parents to come help. My parents unlocked the front door that morning smiling and unannounced. I was nursing my 14-month-old son in my pajamas, and my 3-year-old daughter was on my lap too. My husband walked in from the back door. I felt trapped and ambushed. They confronted me and said, "Elizabeth, you need help." They took my children out of my arms. I screamed out the window that they were taking my children and no one came. Now, I was, and still am a good mother. Hadn't done anything to endanger my children. I was sick and having grandiose delusions about a road to world peace. In my panic, and my children being taken from me, I hit my father and my husband. My father called 911. They asked, "Well, has she hurt you? Or hurt herself?" He said yes. And said, "I threatened his life because in a moment of trying to protect my children, I said, if you take my kids, I will kill you. The police came and said, your dad said you hit him and your husband. I didn't deny it. They told me that I needed to put my kids down and to stand up and come with them. I asked if I could get at least dressed, put a bra on, and they said no. I asked if I could say goodbye to kids, and they said if I did, they would have to cuff me in front of them. I followed them into my daughter's room. They used their knee or elbow to force my arms into the right position. I screamed for help. They put me in a patrol car and took me to the courthouse. I was so confused. I thought I had died. The judge said, I think you need a psychiatric evaluation, not jail, but I don't have any place to put you. I was allowed one phone call and used it to call my best friend. She lives an hour away in New Jersey. She couldn't be here soon enough, so they took me to jail. I was stripped and given prison clothing and sneakers to wear. I was in a cell for many hours. I was confused and terrified. I felt very paranoid and like nothing was real. After bailing me out, my friend cared for me during that first night and the following days. I called the police myself because I was experiencing a paranoid delusion. I was taken to a psych ward of the local hospital. The experience of being forcibly pulled away from my family gave my sanity a heavy blow that I could not shake. For the first time ever in my life, I began to hallucinate. A lot happened while I was not in touch with reality that is now very embarrassing to me. I was unwell, but pulling me away from my kids made me more unwell. I was sicker following a traumatic arrest than I have ever been in my life. Eventually, I got admitted in an inpatient program and I was put on proper medication. I was able to get sleep and I got better. A month later, I was back home in a step-down work program and I went home to my family. Although it was 5 years ago, the trauma isn't gone for any of us. My husband didn't want me to be arrested. He wanted me to be well. If the initial call from my home had gone differently, my dad wouldn't have felt he needed to make me sound dangerous or to be charged with assault. I would have been taken to get services to help and support me. And I would have gotten better without going through hell first and without being vilified. Imagine that when my spouse called 911, he had been directed to another line and got connected to a social worker. The social worker could have told him about hospitals nearby and their intake process. He could have talked with them about how I hit my dad because he confronted me while I was deluded and scared, and they would have listened to him and understood what he said. My spouse is agitated and a little violent at this moment, which is why I need help. But I don't want her to be treated like a criminal. And a social worker, a peer specialist, and an EMT trained to work with people in mental health emergencies could have showed up at our door and given me the help I needed without traumatizing me and my entire family. And entering me into the criminal justice system, which is the last place I needed to be at that time. No one should have to go through what happened to me. I hope changes can and will be made in how mental health emergencies are handled. The mobile crisis program needs to grow so that when someone calls 911 in my situation, they actually get the help that they need. Thank you, Liz. Treatment, not trauma.
Yes. Thank you, Annette. The disinvestment in treatment, in humanity, in mental health help, the disinvestment is real. Liz Fisher's story had a happy ending, but it's not unique. And they don't always end with someone returned to the family. Now we have designated treatment, not trauma workers. If this moved you, if you need to talk, if there's something that you need to reach out to get right now, we welcome you to step over. We want investment in treatment, not trauma. We want to expand the mobile crisis unit. We desperately need investment in people, in humanity. And this is where it starts. So we want to welcome Nikki Grant.
Crisis. That person needs care. You want to access that care, so you call 911. But the most likelihood is that police will show up. Cops can't heal. The best case scenario is that you know the behavioral health landscape and know to call a 10-digit number of the mental health crisis line. Hopefully it's during regular business hours. And hopefully, one of the 2 mobile crisis units serving the entire city can intervene within a few hours of calling. This is completely unacceptable. That's why last summer we fought for $7.2 million expansion in the city budget for DBHIDS to pilot a mobile crisis team expansion program. TNT met with DBHIDS several times to outline what we believe would create a successful non-police response to mental health crises. DBH got that $7.2 million, and we thought that meant that by now, almost a full year later, we would be able to show how successful the program was and how many people were helped. The teams, though, are still in training. The expansion has not launched. It's not even fully staffed. The companies DBHIDS contracted with have struggled to fill the positions, and DBHIDS has not committed to the program operating 24/7 as promised and as we fought for. You would think that there's a clear solution. If the positions on the team are not competitive, the salaries should be raised. This is important work, and the people doing it deserve to have sustainable jobs. But the Commissioner of DBHIDS, Dr. Jill Bowen, does not intend to ask for more money in the budget this year to expand the mobile crisis so the whole city is covered. We know, though, that it's possible for DBHIDS to roll out a successful program. Crisis intervention response teams, the co-responder model of the police, they soft launched in the spring of last year. This co-responder program pairs an armed, uniformed cop with a mental health professional to respond to mental health crises. This program is fully operational. Data on that program was available in September of last year. So we demand that DBHIDS ask for money in this year's budget to expand mobile crisis so that it covers the entire city 24/7. Cops can't heal. The police that killed a young man in front of his to doing better. The police that shot a 12-year-old baby in the back can't be trusted to respond to our struggling children. Whenever tragedy strikes and the police wrongfully shoot or kill someone in our community, the city's response is always the same. More training, more technology, more tasers. In other words, more investment and entrenchment in a broken system, but almost never accountability. Philly doesn't need to arm police with more and different weapons in the hopes they kill fewer of us. We need to reduce the interaction between police and vulnerable community members altogether. Cops have no business responding to a host of situations that could be handled by our communities if we were well-resourced, and especially not mental health crises. So why does the city insist on inserting them where they clearly don't belong and don't even want to be? What's frustrating about Dr. Bowen not wanting to request more money for this potentially life-saving program is that we know that the police have no problem at all asking for more and more money, taking up more and more of our city budget to spend on surveilling our communities and instruments of death. Cops are getting paid to go on long-term leave and have side hustles. The least you can do is ask that money back to have more mobile crisis teams. Cops can't heal. While the city agrees on mobile crisis expansion, they refuse to drop the corresponder model. And now we can't help but wonder if the thing that our movement fought for, that our movement demanded, is just being set up to fail. We won't let that happen. I'm tired of our communities begging for help in the face of rising violence after economically devastating humanitarian crisis that is this global pandemic that continues to disproportionately impact our most vulnerable people and only getting the scraps that the police department leaves over. As the leader of DBHIDS, Dr. Bowen, you can and should do better. At the very least, you should ask Mayor Kenny for the funding and the resources to make Philly's mobile crisis response infrastructure the best it can be. Philadelphia can and should be a model city for mental health care. It's not too late. All you have to do is ask.
Thank you, Nikki Grant, Amistad Law Project. So, we've heard from Nikki. She was very clear. Cops can't help. Cops can't help. Cops can't heal.
Cops can't heal.
And we want care, not cops.
Care, not cops.
We want care, not cops.
Care, not cops.
Communities united will never be divided.
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 Survivors united will never be defeated.
Survivors united will never be defeated.
And so we're asking Dr. Bowen, okay? Dr. Bowen, we need you to prioritize mobile crisis expansion over co-responders. We need the Department of Behavioral Health and Intellectual Disability Services to prioritize mobile emergency. They should get a mobile crisis team. The same way you might get an ambulance for a physical health emergency. Right? Separate from police. The mobile crisis team should be trained well enough in de-escalation to assist a person in crisis where calling the police is a last resort, not the default for a difficult situation. Teams should be culturally competent to understand how Black and brown communities in particular can perceive police presence as a threat, not therapeutic. We also need safe transport. If the crisis situation requires transport to inpatient or outpatient care, measures for a warm handoff should be in place, and the person in crisis must be transported safely and with dignity, not in the back of a police vehicle.